All right. Good afternoon. Welcome to ARCCA's listening session webinar, which aims to gather input on health, wildfires, and climate change to inform a UC Berkeley white paper on the top actions needed to reduce the health impacts of California wildfires. This webinar is being organized by the Alliance of Regional Collaboratives for Climate Adaptation, or ARCCA, in partnership with the Climate Readiness Institute. And my name is Julia Kim. I am a senior project manager with the Local Government Commission, also serving as the coordinator for ARCCA, and I will be moderating this webinar. Just a quick overview of our agenda, pretty simple. I'll cover webinar logistics. I'll probably circle back and cover that again before I hand it over to Bruce. I'll provide a brief overview of ARCCA for those who may not be familiar with us, and then we'll pass it over to Bruce to lead a discussion around, to gather stakeholder input. This is a listening session, so we are trying to get as much input from folks, so hopefully we'll hear from many of you later on. And then a few quick closing remarks, and then we'll go ahead and wrap up. So just to cover logistics, everyone will be muted except for our panelist, Bruce, but we do encourage you to get your audio connected so that you can use the hand-raising feature to ask a question or provide input verbally. If you're not able to connect audio either through your computer or by calling in, feel free to submit a question or a message through the Q&A or chat features, and we'll be sure to read that input out loud as the discussion gets going. If you're having any issues connecting your audio, feel free to chat me, and I will work with you to try to troubleshoot that to the best of my ability as soon as I pass things over to Bruce. This webinar, as a reminder, is being recorded. We'll go ahead and make that available on our website. We'll share that out with all of you by email. And yeah, you should be receiving that follow-up pretty soon after this webinar, either later today or early tomorrow morning. So for those of you who aren't familiar with ARCCA, ARCCA is a statewide network of regional collaboratives working to advance adaptation at the state level while also moving the needle on adaptation locally and regionally. And through ARCCA, adaptation practitioners come together to exchange knowledge, resources, and tools through quarterly meetings, direct peer-to-peer connections, and various online channels. We also support the formation of new regional collaboratives. Currently, we are in the exploratory stages of forming a collaborative in the inland Southern California region, as well as engaging with a few stakeholders in the San Joaquin Valley. We also work to ensure regional considerations are reflected in state planning and funding guidelines, while also serving as a streamlined channel for state agencies to engage with local and regional stakeholders. A lot of this is done through our partnership with the Governor's Office of Planning and Research, who serves as the state liaison for ARCCA. And our current membership of regional collaboratives, we have 7 currently, covering the North Coast, Sierra Nevada Mountains, the Capital Region, the San Francisco Bay Area, the Central Coast, Los Angeles County, and San Diego County. And as I noted, you can see here, the Local Government Commission serves as the coordinator, OPR as the state liaison, and we also have a number of affiliate members working in the adaptation space who we partner with. And if you have any questions about ARCCA, feel free to visit our online home at arccacalifornia.org, or you can also reach out to me directly. And now on to the topic at hand. First, definitely want to introduce our presenter and Bruce, who will be facilitating the discussion. So Bruce Riordan is the Program Director for the Climate Readiness Institute at UC Berkeley and the Director of the Bay Area Climate Adaptation Network, or BACAN. Mr. Riordan is the co-founder and past chair of ARCCA and has previously supported the Governor's Office of Planning and Research through their statewide advisory committee on climate resilience under SB 246, and also served as the climate strategist for the Bay Area Joint Policy Committee, where he led the Bay Area Climate and Energy Resilience Project. Bruce has consulted on climate change strategies for BART, Next 10, the Marin County Community Foundation, MTC, the Bay Area Air District, and that list goes on and on. So wealth of knowledge that Bruce brings. And yeah, Bruce, thank you so much for joining us. Thanks for working with me to get this set up. And with that, I'll go ahead and turn it over to you.
Great. Thanks, Julia. And thank you and ARCCA for setting up the webinar for today. And for all of you out there that are giving us your precious time, thank you for joining us for the webinar. This is, as you know, a very critical topic for California and for the country. And so we're happy to be talking with you about it over the next little less than 90 minutes. So here's the context and the setup for the webinar. Late April, April 30th, we had a workshop at UC Berkeley for about 80 people, academics from on campus at Berkeley and from UCSF and Davis and some other academic institutions, and quite a few practitioners, the off-campus world, interested in wildfires and public health, so public health departments, labor, local government, state agencies. We had a variety of practitioners. And the idea was to bring them together and work on identifying both near-term and long-term solutions for how we're going to attempt, at least, to reduce health impacts from wildfires in California. You know that we're facing a very different regime now for wildfires in California, and it's been very clear how that's changed over the last few years, both in Northern and in Southern California. We started the workshop with John Balmes from UC Berkeley and UCSF and from the Air Resources Board, and Linda Rudolph from the Public Health Institute doing a joint presentation to give some context about wildfires in California and the health impacts in California from wildfires. And then we divided up, and this was really the heart of the workshop. It was a working workshop. We divided them up into 4 working groups, and they worked for a few hours each. The first group on kind of near-term solutions for folks that are living right in a high-risk fire area or impacted directly by a fire. And by near-term, we mean things that could be done, new solutions that could be done, or things that could be expanded in the next 1, 2, maybe 3 years. The second group was looking kind of long-term at that same issue of how do we reduce health impacts? So over the long term, what are the solutions for people living in high-risk fire areas in California? The third group looked at workers, looked at first responders, at laborers who come in and do cleanup after fires, at outdoor workers who could be affected and are affected by smoke and other pieces from fire. And that was the third group. And then the fourth group dealt with smoke impacts. So for people living at some distance from an actual fire, not directly impacted by the fire itself, but dealing with the health impacts from smoke. And so those were our 4 work groups. Again, as I said, we had about 80 people. You know, we have it was a lean and mean workshop. We didn't have a travel budget. So what we assembled were mostly people from the San Francisco Bay Area here and from the Sacramento area, people rather close by. So the idea of today and some other meetings we've been doing through the phone and some in person since the workshop was to supplement that workshop input with some voices from around the state, from other parts of the state, and for people that couldn't obviously make it to Berkeley on April 30th or weren't free that day. So that's why we're doing the webinar. We're going to look at the draft recommendations that have come out of those 4 working groups, and we're going to get your input. What's missing, what needs more emphasis, what would you say differently than we've said so far? So these are draft recommendations, and we want to get your input today during the webinar. We're doing a little bit more input after today, and then we'll be creating a short white paper from all of the recommendations. And that white paper we'll start shopping it around. That'll happen probably later this summer, to start to get traction with policymakers in Sacramento and elsewhere here in the Bay Area and in other regions, air districts, state agencies and all, legislators, to get them to understand better what these health issues are, these critical health issues from wildfires that we're facing and increasingly facing in California, and what can be done to help our people deal with the health impacts of wildfires. So white paper is the outcome, and from the white paper, we're going to be setting up some briefings and various discussions, and we'll see where that goes. So let me share my screen.
And Bruce, while you share your screen,
yeah.
we do have a question that came in. Wondering if you have a list of participants from the April workshop. Maybe that's something that would be included in the white paper, or is that something that could be shared sooner?
It can be shared tomorrow when you're sending out a follow-up, right, to the
Yes.
webinar, and I can give that to you, and you can share that with everybody. Okay.
Perfect. Thanks, Bruce.
So let's start right in. We have 4 groups to look at, or 4 sets of recommendations, and we want to go one by one and take 15, 20 minutes, whatever it takes for each one. This first one is about near term, so things that could be done in the next year or 2 years, maybe 3, near-term solutions for reducing health impacts for people who are living in or near high-risk fire areas, people that either are or could be directly impacted by one of the fires. And so you'll see what the group came up with. Let me go down, and I'll scroll down the left-hand column. We asked them to come up, debate and discuss, and come up with 5 top solutions. So the first was around technology solutions, kind of a broad category for better fire and smoke monitoring, better communications, better use of technology for evacuations and other types of activities like that, during an immediate fire event. The second was, before we get to fires, an outreach and education program really tailored to specific communities so we can reach them effectively on the health impacts from wildfires and smoke, so that people can understand better what the issues are and what are the kinds of things they can do personally to make themselves more resilient, or their household more resilient when we do have fires. Third, and this is true for all climate adaptation, building more community capital, building stronger communities, period, so that when we have, in this case, wildfires, we have a more resilient community to begin with. And the kinds of things that we can look at for heat and for flooding and for drought. Similarly here, how can we, or earthquakes even, non-climate, how can we make our communities stronger with healthcare, with neighborhood cohesion? What are the ways that we can make our communities stronger, strengthen our community-based organizations, ideas like that. The fourth, going down the list here, and again, these were things that we thought we could do and expand on in the next couple of years. This one was more kind of hardscape stuff about evacuation routes and shelter-in-place procedures. Better work on setting up high-risk fire areas for evacuations and shelter-in-place ideas, again, before fires start. And the final one here on their list of 5 was to do more infrastructure hardening so that we can, again, not have as much damage to critical infrastructure during fires. So those were the 5 top solutions. You'll see in the second column, we won't go through all this. We're more, here's what the actions would need to be to implement that, or it's more detail about the solution. And then the third column you'll see is about what research, because we're looking also for research to support these solutions. What don't we know? What's the knowledge? So we can take comments on this first one, and you can think what's missing. Do you think if you see something that's missing, what needs to be stronger, more emphasis, what doesn't have enough emphasis? What do you think about these 5 proposed solutions, again, for near-term people living in high-risk fire areas? And again, you can raise your hand, and Julia will recognize you, and we can hear from you on this. We're happy to listen. You can also use the chat function to put in comments. You don't have to give them to us here over the air. And you also see my email in green at the top of this sheet. It's on each sheet. You can email me comments today, during the webinar, or later. So with that, who would like to start and give us some feedback? Are we on the right track here on this first set of solutions?
Yes, definitely encourage folks use that hand raising feature. Feel free to chat something in. Feel free to put a question in through the Q&A portal. It sounds like we're having some great engagement on the chat. Just to catch you up to speed, Bruce, there was a question from someone just to the broader group around if there has been any kind of mapping that overlays vulnerable populations with high-risk fire areas. It looks like where we landed is that, CAL FIRE has may have a map, and obviously there's Cal EnviroScreen, but there isn't currently a single map that includes those different factors as layers. Is that how you understand?
Good. That's how I understand it too, and that's what I understood that came out of this work group. There are some things that have been done in some communities locally, but that we need much more of that. And what we got from the workshop was a need to really map in some detail at the neighborhood and community level who are the vulnerable populations, either from mobility issues, from hearing issues, from a whole set of issues that are going to make it harder for those people to, say, evacuate or to know when to go or where to go when evacuations are called. And so you'll see in the second row down here in kind of the middle column, there was a calling out of California Association of Community Healthcare Workers, promotores. We talked yesterday with unions that represent in-home workers and all folks that could help in a great way to map who are individual household by household the most vulnerable populations in each community, so that we know that going in.
Wonderful. It looks like Javier has his hand raised. Javier, I am going to be unmuting you right now.
Welcome.
Javier, it looks like, let me see. Oh, sorry about that. I think now you should be. I'm not sure if you are muted possibly on your end. That might be preventing me from unmuting you. Okay, looks like we have Erica's hand raised. Sorry, Javier, I'll loop back with you in just a moment. Erica, I will unmute you right now.
Welcome, Erica.
Sorry, Erica. For some reason, this feature isn't working as it should. I'm going to lower your hand, Erica, and see if I can unmute you directly. Erica, are you there?
Yes, I'm here. Can you hear me?
Great. Yes, go ahead, please.
Perfect.
Thank you.
Okay. So looking over this, I think there's a lot of things that are captured. I think maybe one of the top solutions that may be missing could be emergency communications. So not just the technology, which is included, but a solution that focuses on the messaging, the strategies for dissemination of emergency messages and warnings to all populations, in addition to vulnerable populations. There's a lot of guidance from the social sciences on how to structure messages disseminated via different channels to effectively evacuate populations under imminent threat.
That's great. That's very good, Erica, and thank you, because we have under outreach and education kind of pre-fire work, but you're talking about emergency communications and the kinds
Correct.
of messaging that we need and the kinds of strategies. So thank you. That's a great add to this and just what we're after in the webinar today.
Great.
Wonderful.
Excellent. Thank you.
Javier, I'm going to go with Javier, it looks like you might be unmuted. Why don't we pass it over to you, and then I'll go ahead and kind of read out loud what's been happening in the chat, since we were getting some great input there as well. Javier, are you there? Okay, Javier, I'm going to keep you unmuted just in case hopefully it's just a slight technical issue, and we can hear your voice very soon. But others, I definitely encourage you to use that hand raising feature. It can work. So Bruce, just to catch you up on what's been going on in the chat room, we have a
Sure.
comment from Lisbeth. Would love to see greenhouse gas reduction in all draft recommendations, being that it's the leading cause of climate change and thus the cause of the increase of wildfires. Much more stringent regulations need to be instated.
Good, we can do that. We can put that in. That's kind of a given with the recommendations, that I think making it explicit would be smart. And we agree. The biggest thing we can do for any climate adaptation is to reduce emissions very significantly. So thank you for that one.
Wonderful.
Next.
We have another one from Norma. Norma says it's on the right track. However, the recommendations should indicate initiatives that are currently in process that are part of the solutions. So, for example, emergency preparedness grants.
Good. That's something we've wrestled with, because we understand that this workshop is in the middle of a lot of work that's going on all over the state, Sacramento, but elsewhere as well, and how to. What we've struggled a bit with is the old how to fit these recommendations and this work into that ongoing work, recognizing that some great stuff is going on, and how do we build on that and add to it. So, we did a literature review, so that at least caught us up on much of the research, but it was beyond our scope right now to identify all of the programs that have been implemented or being implemented and funded either at the state level or locally. I'll think more about how we can do that, because it's important to make it clear that we're trying to build on and acknowledge the things that are being done already. Thanks, Norma.
Great. We have another comment from Jeff. Jeff says, a slight editorial suggestion regarding building community capital to create stronger, more resilient communities before fires. The suggestion is possibly include between fires to recognize those areas where fires are recurrent. Okay, good.
And that's certainly been an issue in a number of our areas in California recently. Thank you.
Another comment from Gary. This is indeed a very broad range of subjects, most of which are within the category of sustainability. As I have expertise on a global level, the overarching perspective may be necessary. How does one approach this towards overall successful implementation?
Well, we are taking a rather focused view here, even though these are wide-ranging issues and with wildfires and health and a wide range of solutions. We're trying to focus on things that we can do, and on this sheet A in particular, things that we can get funded and get going or expand if they're already going in the next couple of years. So we're not taking, I will admit, we're not taking the bigger frame here of sustainability. It's a good question for the state of California as we start to put more money finally and more attention on climate impacts, on sea level rise and drought and heat and fires and all flood. What's the bigger frame for this? And are we going to go, there's a lot of work on wildfires right now. Well, if we have a big and very hot summer, which is very possible, are we going to then kind of shift to having a big focus on heat? We had a focus on drought for a number of years and not on other issues. So it's really a question that I can't answer here right now today, but it's a good one for the adaptation work. How do we build a California state, regional, local, kind of public and private sector, nonprofits? How do we build an integrated program around adaptation as opposed to a program for wildfires a program for sea level rise, and down the line. So good question. I don't have a great answer for it today.
Mm-hmm. Great. I'm going to flip over to the Q&A portion really quick, then I'll loop back in the chat. We have a question from Sasha. Is the focus of the recommendations on the solutions level or the actions level? And just based on the document you're sharing, it seems like both, but wanted to get your thoughts on that, Bruce.
It's focused on solutions because that's where we're going to start in terms of briefings. But what we tried to do in the workshop, and we're still, as you can see, it's a work in progress, with the middle column, was to get at what are the more specific things that could be done to get that solution in, and also what's needed, what's the problem, why hasn't that solution already been widely implemented, or why is it only partially implemented? So we wanted to get at the need for funding, the need for specific programs to get funding, the need for, in some cases, new regulations or even new laws. That's what we were trying to do with the middle column. But I think it'll be a combination when we do the briefings and all, and the white paper will certainly reflect that.
Wonderful. All right, and I'm typing up the response to that, so folks will see that in the Q&A panel in just a moment. We have
Julia. Let me just add one thing to that last answer. I would be happy to hear input on and use my email here on input on that question. In terms of going out and getting traction for this work. How specific do you think we need to be? Can it be more broad, kind of more broad strategies? What do you think would be most effective? So I would take your emails on that. So thanks, Julia. Back to you.
Perfect. Wonderful. All right. That is now officially answered. See that up in the Q&A panel for all of our participants. We have a comment from Rosie. It's a question as well. She noticed that the shelter-in-place solution has no actions associated with it. Any thoughts on this one?
It's because we had 2 hours, and there's no research with that one in place, right? Is that what the question is? Because there's no research yet on this one. No research identified. There are some actions there. But nothing in the research column.
Mm-hmm. Right. So as a reminder for folks, on the left side, you'll see the solution, the middle column, the actions, and the right side, the research needed. Before I continue with the chat log, it looks like we have a hand raised from ARCCA. ARCCA, I have unmuted you.
Yes. Can you hear me?
Yes.
Okay, thanks. Just a quick one, and that's on the same row that we were just talking about on evacuation routes and shelter in place. There's a question there. I know maybe we're not talking about the third column, but the research needed in question mark. Bruce, in an email, I sent you some ideas for some research possibilities in that row. So feel free in your white paper to take a look at that and maybe add those if you think that they make sense.
Great, thank you. And I should state clearly, we are looking at we're interested in the third column as well. So any ideas that any of you have for research gaps from the work that you're doing, we would be very interested in that. And again, I think use the email function. We'll scroll back up and you can see Bruce at climatereadinessinstitute.org. The researchers that I'm working with here on campus at Berkeley will be very interested in hearing from the practitioner community what you want in terms of and what you need in terms of research. So thanks. Julia, we probably ought to do one more and then move to the next one because we've got 3 more to do before 3 o'clock. Sure
thing. So there are a couple comments that I'll just run through super quick if I can. But we'll also we'll be exporting the whole chat log and giving that to Bruce, just FYI for folks. Just a quick comment, SB 901 is recommending requirements to evaluate and identify communities that are going above and beyond to prepare and mitigate wildfire. is from Andrea. She believes there's a checklist that is being developed to assist at-risk communities. This resource should be included and provided in Community Capital.
Thank you for that. Yes.
Have that.
Okay.
Let's see. So another question I'll just call out from Monica. Could be helpful to maybe identify who may be responsible or could lead certain actions. Is that something that's being considered as part of the white paper?
I think we will be able to do some of that with the white paper. That's going to be drawing in some of the experts that helped us put together the workshop in the first place. So I'm hoping to do that. Yes.
Great. And then one more thing, just because I think this is so important, from Molly. Mental health stress and trauma are noted in the problem, but post-fire support is not addressed in solutions. We need to build best
good.
Help communities recover stronger and make the links between policy, personal behaviors, and the impacts of climate-induced disasters. And I think we can now maybe move on. And again, we'll share that full catalog with Bruce afterwards. And back over to you.
Good. Thank you all for everything on Group A there. And as Julia said, I'll get the entire chat function readout. So your comments there and your comments on my email will all go into working on the next version of the recommendations here. So the second group that we had worked on longer term solutions, again, for people right in high risk fire areas. This was working Group B. And so we were looking, maybe things are you need to start many of them now, but it's not that they all have to wait, but that it's going to take a while to get.
Bruce, I think we might have lost audio, or maybe that's my connection.
Change among the general public, really taking some time to bring about that with public education around the need to change our forest management practices. Secondly is actually the forest management practices themselves. So the first was kind of getting public support for that. The second was making a more comprehensive approach to our forest and vegetation management. The third, aligning financial solutions. We all know how powerful financial solutions are in any of the climate impacts that we're working on. So instead of having them all work kind of separately, the idea here was to start to figure out how to align insurance, bonds, development fees, and all to again start to reduce health risks in high fire areas. Fourth, land use, big one on wildfires, big on sea level rise, on a number of adaptation issues, as you know, in California. What are we going to do in terms of land use regulations, in terms of new development or existing development in fire-prone areas? In areas, as someone mentioned a few minutes ago, we have areas that have had recurring fires. What are we going to do about that big, thorny issue? And building adaptive capacity in fire areas longer term. You can see some of the things in the middle column that the working group called for there. Again, kind of more over time, building that adaptive capacity in fire-prone areas. And finally, as someone mentioned a few minutes ago, accelerating our actions to substantially reduce greenhouse gas emissions. For California to lead the way here in this country and in the world is going to be critical. And as you know, it's a global issue here that then we end up with local impacts from fires and other things, but certainly reducing GHGs.
And Bruce,
so,
sorry to interrupt.
Yeah, go ahead.
A quick process check. I believe you are meaning to share the Group B score sheet. You might have your share set to a specific document instead of your whole screen.
Okay, and so okay, I'm going to have to go back here. Okay, we'll do that. Thank you. This is new software to me too. Sure. New share, and we'll go to B. And okay, so there's the B. Hopefully you're all following along on your scorecard at in the office with the ones we sent out, but here it is on the screen for Group B. So culture change, forest and vegetation management, aligning financial solutions, reforming land use regulations, and building an adaptive capacity, and of course at the bottom, reducing GHG. So again, are we on the right track here, or what's missing? What would you put more emphasis on or word differently?
All right, we have a hand raised from Jeff. Jeff, I'm going to go ahead and unmute you now. And yep, you are officially unmuted.
Welcome.
Jeff, are you there? I'll keep you unmuted. You might be muted on your end. But you have been unmuted, so I'm not sure. It looks like you're connected through your computer audio. Not sure if there may be an issue there. Sorry about that, y'all. But Jeff, yeah, I think you might be muted either on your end or there is an audio connection issue, maybe from your computer. Since we're not able to hear you, maybe feel free to share your comment and provide input through the chat panel or through the Q&A portal.
So comments, questions. Again, you can use my email, which is at the top here of Working Group B's initial draft recommendations, or you can use the chat feature, or you can raise your hand and Julia will attempt to unmute you.
We have a comment from Andrea. To increase the pace and scale of managing forest lands, it should be important to develop a streamlined CEQA process.
A streamlined CEQA process as part of that second row. Okay. Okay. Thank you for that.
I have another comment from Rosie. A land use regulation reform could also consider transfer of development rights program out a transfer of development rights program out of high fire hazard areas.
Good. Yeah, that's good to get a little more specific there on land use. It's such a you can see how the working group. You weren't there for the discussion, but you can see from their first bullet in the middle column that they punted in a way to let's create a state and local blue ribbon commission to look at all of this, because it's going to be such a politically difficult issue, but something that pretty much everybody knows we need to face up to. It's just hard in California.
We have a comment from Jeff. Great to see your comment, Jeff. Sorry about the audio issue. So regarding culture change in California, how much of the forests of California's forests are on federal land, and how will that culture change be implemented in that regard?
Good question. I think the figure for federal land, I don't have it right in front of me, is something like about 60% of the forest. I mean, it's a big number for our forests in California. That dates way back to federal land grants and all. I think the idea here is that the working group came up with was to shift public opinion and support about forest management. You know, we've had for decades in California I'd say the primary public feeling on forest management and fires has been to put fires out as quickly as we can under all scenarios, and it's led to a lot of as you know, overgrown forests that are very susceptible to big hot fires, the kind that we've had in the last few years. So along with climate change, we've had forest management practices that have certainly led to and been a factor here in our increase in wildfires all over the western United States. But I think the idea the working group had here was we need to start educating the public more and engaging the public more on why we have to do a different set of forest management practices with thinning, with prescribed burns, and a variety of other things to get public support on the side of changing these policies that are both at the state and federal level. And I think their idea was that if you can shift public opinion, we can start, this may be a question mark, start to affect the federal practices as well.
We have another comment from Jeff. Regarding research needed to support the solution for expanding the pace and scale of forest and vegetation management, perhaps add a bullet pertaining to the dynamics of the intense and large fires we are now enduring.
Good, great.
We have another comment.
That'd be helpful.
One from Melanie, also in respect to the forest and vegetation management. One consideration is hoping to see increased funding forest management strategies. She's hoping the increased funding forest management strategies includes defensible space clearing for residents in extreme fire danger areas, including those who are LMI. The expense of clearing defensible space for a LMI homeowner is a challenge. I think low to middle income. I'm actually not sure.
Yeah, good, great. And we'll make sure, I thought it was in already, but if it's not, certainly we'll include defensible space there as part of the what funding is needed for. Thank you.
Bruce, did you want to scroll down in your document and maybe folks a little more time on the other categories you had listed?
Yeah, we've got the GHGs at the bottom. We've talked about that a little bit. Building adaptive capacity, there was a variety of things here. You can see about, these are kind of backbone issues, rural broadband, so that people can get better information and emergency communications. Again, funding communities, that first bullet there, not just funding for agencies to come in and do forest management and all, but community-based programs where communities certainly have, local communities have a lot of knowledge about what could be done and what should be done in their own areas to make them more resilient to wildfire. There are a variety of things here in the bullets under adaptive capacity, and the one above for land use too.
Just a quick thought from me, Bruce. For adaptive capacity, do you see workforce development fitting in there, as well as kind of business development and promoting or incentivizing industries or new businesses in a high fire risk area that could enhance adaptive capacity?
Sure. No, that's good, and let's make sure we include that in the log here. I mean, the fifth bullet down talks more generally about economic resilience. Again, rural areas in California are most often economically in trouble already, and so building economic resilience and building new job opportunities and economic opportunities in rural areas long term, again, because that's the page we're on, is really got to be a strategy that's going to help make those communities more able to recover after fires. So yes, building that adaptive capacity got to have a number of pieces to it there.
Great. We have
Okay.
another comment from Jeff regarding reforming land use. What discussions are underway and with whom to, what discussions are underway and with whom to explore how to think about relocating communities, not just individuals within a community, and be aware that measure tree can have a negative connotation, which he's sure that you're already aware of.
Yeah, I'm sure that these discussions are going on in Sacramento. We have not been a party to them at this point, but and so I can't really answer that question, Jeff. But that's something certainly that we'll be poking into as we do briefings and discussions in Sacramento after we complete the white paper.
I have a couple more comments. One from Norma, as related to forest and vegetation management, there are many collaboratives that focus on forest health that work with the USFS and are engaged in doing comprehensive mapping to help identify priority project areas. Norma, I think you're talking about the scale collaboratives, possibly. And also there has been some recent research regarding prescribed burns. And maybe if it's not the scale collaboratives, there's also the scale collaboratives. So that's
good. Thank you.
We also have
we have the big the 35 different projects that were identified by the Newsom administration's task force recently for priority areas for forest and vegetation management. So unfortunately, there is a lot that has to be done on this. It's a huge issue for California just in terms of the numbers of acres, but there's a lot of attention being paid to it right now, as many of you know.
Great.
Got one more, Julia, and then we'll go on to the next sheet.
Perfect. We have one more from Molly. Her suggestion is to develop partnerships and tools to prioritize multi-benefit vegetation management strategies. We need to be strategic with our investments given the scale of overgrowth in our forests, and that strategy should be guided by a multi-benefit approach.
Good, great. We can certainly put in more multi-benefit language there. So thank you again for your comments here and through the chat function. And I won't look at my emails yet, but I'm hoping that emails are coming in here as we look at now. We've done near term and longer term for the high risk fire areas. And again, thank you for your comments. It will help in sending me emails or in your chat function comments if it's not really obvious which kind of square or row you're talking about to point out it's the second row or the middle column or whatever. Anything that will help me decipher will be helpful. Okay, so now we're going to go back to new share and we'll go to Group C. And Group C was interesting because Group C was a group of about 15 people at the, got the wrong one here. Let's try that again. Do share. Let's do C. That's curious. I'm clicking on C, Julia, and it's coming up with this is C.
I don't know if there's like an older version, but I can see workshop Group C. This one is how to protect workers from adverse health impacts during and after fires.
Yeah, and if I scroll, can you see that now?
I cannot.
Oop. Yeah, because I'm off the shoot. I wonder what happened here.
I could also, as a backup, I'm also happy to download the version that you shared, that we circulated, and I'm happy to share my screen if that's helpful.
Yeah, let me just try one more time. Sorry, folks. Yeah, this one says it's okay. So there's Group C. That should. Are you seeing my Group C now?
Yes, I can see C.
Okay, and I'm scrolling, and it's going up and down.
Yep, scroll is.
Okay, all right, good. Sorry, folks. 21st century here. Okay, So this one is about workers. And so we were looking originally at first responders of various sorts. We were looking at laborers who come in and do post-fire cleanup, but this group expanded it some to include outdoor workers who are impacted by smoke, so farm workers, construction workers. So it's people, it's police and EMTs and others that are, as you'll see in the problem section at the top, anyone affected by smoke events, and that at some distance usually from the actual fire itself. And this group, there always has to be one group in every workshop that breaks the form, but they did good work, so we applauded them. You'll see that there are kind of three rows going here, and the first one is about preventing harm for workers. How do we protect workers who are doing forest management, who are doing fire suppression, who are doing energy shutdowns, kind of stop harm from happening. The next would be reducing harm during fire events and smoke events. So how do we give them, respiratory protection? How do you rotate workers in and out? Clean air base camps, there were a variety of ways that you could reduce harm for people that are stuck in either a fire or a smoke situation. And finally, then, after a fire or after a smoke event, managing and treating those harmed workers. So little slightly different framing here, but again, the three columns of here are the solutions, middle column of more what the actions could be to specific things to implement, and then research needed on the far right. So we'll be doing smoke and smoke as the last as Group D, but for Group C here, in terms of workers, all sorts of workers, are we on the right track? Again, what's missing? What would you emphasize?
We have a question from Andrea, also just great input. What is the status of working with drones to reduce harm to workers during and after fires?
Well, I don't know, but drones are being used obviously more and more for all sorts of things. I was talking with some insurance adjusters the other day and how much easier their lives have become going into fire areas after fires and sending a drone up in terms of, instead of having to get up high themselves or get up on a dangerous structure. I think, obviously CAL FIRE is using drones in terms of fighting fires and then directing workers. I don't know specifically, Andrea, beyond that, although, we're seeing drones now everywhere.
Great. We have a comment from Nikki. Impacts on workers. This should also consider outdoor recreation workers like park rangers, recreation resource managers, trail workers, or vegetation managers.
Fabulous. Thank you. Yep. We will, we keep expanding this group because, the outdoor workers is really going to be a tough deal. As we get more smoke events in California, and we will, how do we protect the health of people who have to be working outside, or this workshop group expanded to include workers who are in indoor locations but unfiltered, or where doors are open, like auto repair shops, those kinds of things. It's going to be a really difficult one, but something we're going to have to work on and contend with.
We have a comment from Kayana. So sorry, hopefully I'm pronouncing that correctly. As someone who has worked on fires, my friends who were affected by smoke in urban areas in the last 2 years asked and assumed I wear a mask. I don't. And the attitude by most wildland firefighters is to laugh or chuckle at that thought. Is that a cultural norm that should be changed? Or are there just terrible equipment options for doing that kind of job in the wetland?
I'm not sure I get this one. Could you maybe rephrase it there?
Absolutely, I could summarize it. So basically, she works on, she works on fires, and people, some people who don't work in that field assume that wildland firefighters are taking those protective measures, such as wearing masks. But there's actually a cultural norm to where firefighters will kind of laugh at that, at the thought of wearing masks. He's wondering, like, hey, is that a cultural norm that should be changed, or do we actually just need better equipment options for those who are doing that kind of work in the wildland?
Yeah, I think this workshop certainly identified the latter, that the equipment, and there's some work on this in the new research study out of Berkeley, on the front page of the San Francisco Chronicle this morning, and maybe in other papers too, on mercury exposure by firefighters in the set of fires last fall, unprotected basically, and it's a very serious issue when firefighters work on urban fires here. They can be wearing a breathing apparatus and filtering apparatus and they can go back to trucks rather simply and get a new tank, or they're only in a fire for half an hour or something like that. But when you're working these 8 and 10 and 12-hour and more shifts, where you've been called from an urban area now to work on a wildfire, say that burned into Santa Rosa or in the Paradise area or into Redding, you're putting firefighters at great risk without sufficient equipment. And this working group really, emphasized that point and the real need. And there's a fair amount of work going on, we're told, in Sacramento right now on new regs and regulations around this kind of thing to improve it, because it's we've seen the big studies of the 9/11 workers in New York that have suffered tremendous health impact, some of them from the work that they did that day on 9/11 itself and in the post-fire cleanup. So certainly a big issue in terms of equipment.
Right. And kind of similarly on that note, if there is still a challenge related to the cultural norm, I don't know if updates to OSHA regulations, that would certainly apply to some outdoor workers, at least construction workers, if that's something that the group discussed. That's just a quick thought. And we do have we have at least one other comment from Gary. The preventing harm category is the province of earlier work by Harvard School of Public Health, as the fires also expose and distribute toxicities from building materials into the global airstream.
Yes, definitely. More than a local issue. And certainly the fires that have burned into urban areas, the wildfires that have, come into Santa Rosa and Redding and Paradise and other places have certainly exposed everyone in that area to toxics, because you're not talking biomass now. Some of the research shows that by the time you get at some distance from the fire, that those toxics are in rather low quantities, but certainly in the immediate fire area and around it, toxics are an added problem here on top of kind of old-fashioned wildfires in the forest.
I'm not seeing any other chats or questions. It doesn't look like we have any.
Okay, well, thank you again on this one. We had a whole group. We had firefighters working on this one at the workshop, and staff from the Blue Green Alliance helped. We had some labor union help with this one, so it was quite an interesting group. So let's go on to the final one here, and thank you again for sticking with us and giving us your comments in the various ways. So let's go with interesting. Let me go back and try it again. Okay, so Julia, you should be able to see mine that says working groups D1, D2, and I'm scrolling a bit up and down.
Absolutely, looks good.
Good. Okay, so folks, here's the last of the four, and this one we had quite a bit of interest in the workshop. That's why we actually had to have two groups in two different rooms working on smoke issues. We combined their recommendations, and the first, as you can see as we go down the left-hand column, was creating really a coordinated game plan. There's a lot of work going on around smoke and health issues now. There's research going on. There are new communications strategies and all, but what this one called for in the first row was to bring some coordination to all of that, so we don't have just a series of pieces, but a coordinated game plan that we can implement over the next few years. The second, in terms of smoke, was developing intervention solutions that work for different populations and that are identifying and acknowledging that while smoke is going to hit smoke events will hit everybody, certain populations and communities will be hit harder and have a harder time recovering for a variety of socioeconomic reasons. So equitable intervention solutions was really the theme here for dealing with smoke in the second row. The third was low-cost technologies, new sensors, building filtration system, masks, and all that can be widely deployed. You know, we found in the Bay Area here in the North Bay fires last year that we were very unprepared in terms of the kinds of things that need to be out there and in place, so that when we have smoke events, we're much more ready for them. The next, and so important here, a coordinated communication strategy. You know, there's some work going on in various venues that I know of here in the Bay Area and elsewhere now on getting a handle on this, so that we don't have every county having to go it alone, or every city or every school district on deciding what advice they're giving their constituents. Should schools stay open or close? You know, are masks appropriate or not? We had a lot of conflicting, I would say, communications last time, and that's something that they got at here on the fourth one. And finally, managing fires more with a health lens to reduce air quality impacts from fires, so that we can so that smoke events aren't as pervasive. So 5 things there. Again, what's missing? What would you put more emphasis on? What would you reword? Be happy to hear your comments on smoke.
Great. Javier, oh, excuse me. Javier, looks like you have your hand raised. I unmuted you. Hopefully this time around we can hear your voice.
Hi, can you hear me now?
Yes, we can.
Yes.
All right. So this is Javier Saucedo. I work and live in the county of Ventura. We had about 500 homes burned down to the ground. So one of the issues that we're having right now is that a lot of the standing homes became impregnated with ash, soot, and everything in their attics. So there's a lot of issues right now with the infiltration of the, a regular attic going inside the home. So people are still smelling smoke, smelling the taint. And so there's a big problem that we need to address after the fire. How do we clean these attics up, and how do we get rid of this ash that's up in the attic, and then perform an air seal. Something that, the insurance companies don't really get into it, because this is a home performance field, not an insurance thing. So we're doing a lot of that. So I would like to put something in there so that, you know, after a fire, somebody goes out to these homes and does an assessment and teach people why is it that the attic is part of the home and needs to be addressed.
Great. We can, thank you, Javier. We can add that here. That's a great add. Thank you.
Right, and we have a comment from Rosie on a similar note. Also wondering if the topic of smoke would include ash, and again, how ash can linger for months all over your property, if not longer, and all the health impacts related to that. We have another comment from Norma. There are pieces of legislation that are pertinent to this discussion, including SB 130 and SB 462. SB 462 specifically deals with forest land restoration workforce program at community colleges. Yeah.
Okay, we can include that. Good. Thank you.
We have two comments from Jeffrey. The first being, with regard to distributing low-cost filtration systems, as with many things, you get what you pay for. What is the thinking about what is considered a low-cost air cleaner?
Yeah, this one came from the workshop, and I've got to go back to it and look at the notes because, you know, I think it's a bit of a contradictory statement that building filtration systems are not low cost for the most part. Certainly masks can be if they're effective and used correctly. There's certainly a number of things I know of projects from a startup that started here at Berkeley on sensors, smoke sensors and all, and PM particulate matter sensors. So, and they're low cost kind of versions of that, not the $5,000 versions. But I think we need to go back and look at the notes and maybe take that part out, because low cost building filtration systems are, unless someone wants to correct me on this, I'm not sure that they exist in a very effective form.
Great. We have another comment from Jeffrey. For those affected by heavy wildfire smoke and who may not be able to stay at home or create a clean airspace at home, is there a statewide database of shelters where people can go to get respite from smoke? Is there any consideration for developing official criteria for cleaner air shelters or spaces? Perhaps so they must meet a minimum for indoor air quality. And I will note there is a current legislation that's going through the process right now that does look at air kind of smoke shelters, clean air shelters for that air districts would be required to look into. But Bruce, any thoughts?
Yeah, that's good. Thank you. Thank you. Yes, and my only response would be that there are various groups looking at this, and there are probably some that are going further than just looking at the idea. Similar to what we have right now for cooling centers in some communities on extreme heat days, because we have extreme heat plans in many counties. So cooling centers are part of the strategies there that are implemented. There's certainly some research on this, and I won't call it up right now on the effectiveness of this, and for one of kind of smoke-free centers and how effective they are if you go for an hour or go for 2 hours, something like that. But we can look at that one more. It's the other issue again, as with the heat and cooling centers, is transportation. If you're only serving people who can afford the transportation or have the transportation to get to the cooling center, or to, in this case, the smoke-free center set up somewhere, then you're missing many of the most vulnerable in our communities. So it would have to be a combo with transportation.
Right. All right. We have a couple hands raised. Javier, I'll go ahead and unmute you first, and then Erica will pass it over to you next. So Javier, the mic is yours.
Yeah, just a quick comment on the air cleaners and the air scrubbers. for days, people had them in their homes here in the area. And what they were doing is basically just sucking air from the attic into the home and attic from all around because of the attic, the attics being vented. So they went on for weeks trying to clean the air, and all they were doing, it was just kind of collecting air from outside, bringing it into the inside of the home. And the clients were just like, how can we fix, why it's going on? Why is this not cleaning? And it goes back to the same issue of infiltration in all these homes. They're just wide open to the attic. So there was no fixing until they basically sealed the attic and, removed the insulation that was out there, full of ash.
Thank you.
All right, Erica, I am unmuting you now.
Okay, thank you. A previous comment made me think about this. I'm not sure where this goes, Bruce. Hardening hospitals and other critical buildings from smoke and other fire conditions so that hospitals don't have to evacuate patients in fire conditions. That's my first comment. And my second comment, I was glad to see on, I guess, in one of the boxes related to equitable intervention solutions that there was a note to clearly identify the most vulnerable populations. I think that is an important one, since the populations that are most vulnerable in smoke are not necessarily the ones that are most vulnerable in the context of evacuation or receipt of emergency communications. So across the board, depending upon the topic of the focus, I guess, it's important to define the vulnerable populations in each case.
Good. As opposed to one size, doesn't fit all.
Correct.
I think is what you're after. Yeah, good. Good. Thank you. We'll make sure that we make that clear.
Right. And just on that note, just a quick personal experience with the Thomas fire. I ended up going down there right after the fire. I was helping a friend with their family's house, and they knew their neighborhood so well, and we actually went around and checked in on those who were older or people who might have mobility issues, to actually go around and close the windows and make sure the home was sealed. So little things like that, like possibly an opportunity to empower residents and communities really at the neighborhood scale. That could be a possible action. And then we have another comment from Nikki, possibly a research question or intervention. Has anyone reviewed state weatherization programs to see how adequately they address smoke infiltration?
That's good. We can inquire on that one. I don't know the answer. But that gets to something that local health departments have talked to us about on fires and on other issues, is that we often have these siloed programs, and for instance, for weatherization, that you can do X, but not Y or Z, because that's the way the program was set up. It was out of energy funds, or it was out of health funds or whatever, and breaking down those silos so you could actually look at a home in terms of say weatherization that can be both energy efficiency work and money-saving work, and deal with smoke. That'd be smart. So we'll make a note on that. That'd be a longer-term kind of thing. Silos are kind of often the game because of funding restrictions, but longer-term, breaking that down would be smart. Thank you for that.
Right. We have a comment from Pam. What about non-grid power, so microgrids for hospitals, schools, or emergency response centers if utilities have to shut power off?
Yes, it's certainly, there's a fair amount of work going on that, and it's probably something we should include here, even though it's already in progress. Those, that's back to another form of hardening those structures and those services so that they're available to us. When you get hospital workers who, their building may be hit by smoke or by fire. They're dealing with their patients who are being hit by smoke or by fire. They may end up losing a job even temporarily because the place that they work was hit by smoke or fire. You know, there are a whole set of issues there.
We have one more comment from Norma. Are there smoke alert systems to warn surrounding communities? Are there smoke alert systems to warn surrounding communities of possible health risks?
I'm not aware. I'm sure there are some at this point, but you know, I think the emergency kind of communications work has been more around the fires themselves. From the people we've been interviewing and from the you know, looking at some of the research and program summaries, I'd say much less on smoke warnings and all. I mean, we've had great confusion around smoke issues. Is a 300 number that you shouldn't go outside at all, or can you go outside some? I mean, what do the numbers mean? What do they mean for different populations? We have a long ways to go to figure that out. I know the Air District here in the Bay Area has been working with local health departments and other stakeholders, BARHA and some of the others, to come up with a more coordinated communications set of messages and then a strategy for getting them out. But we haven't seen any results of that yet. I know they've been meeting and talking. British Columbia, we found in the literature review, has done quite a bit of work on this, so that they've seen the best way to do this on communications and all is to get these systems in place and the messaging and who's going to say what and when do certain things get triggered. Get them built and agreed upon ahead of time. You're not trying to do them during a smoke emergency. So I'd point to British Columbia as a good example so far that we found of where they're ahead of the game compared to us.
So it looks.
Julie, go ahead.
Just one more follow-up from Norma.
Okay.
So it looks like we need an outreach and information strategy for communities when facing health issues resulting from smoke. I don't see anything else on our chat log or in the Q&A portal. I don't see any hands raised. Maybe one more final call for folks to provide some input at this stage, but of course, we welcome you to provide additional input and encourage that directly to Bruce by emailing him after this webinar. Maybe we can give folks another 30 seconds and then maybe we'll pass it back over to you, Bruce, to wrap up.
I just want to thank everyone for giving us your time and your expertise. And these are, as you know, ongoing issues for your communities in California and beyond. And we're interested in being a small but hopefully helpful part of accelerating the work here to find the solutions and then to find funding and mandates and the kinds of things that are going to be needed to implement these solutions. So I look forward to your email comments. You can send them to me today, or you can, anytime. Let's just say the rest of this week. This is Wednesday through Friday. Send me email comments, and we'll be again taking your comments here today and the comments of the original draft recommendations from the workshops and some other input we've been receiving, and creating a short white paper from that. We'd be happy to keep you in the loop with all of that when we have the draft of the white paper ready for review. I'd just say thank you from Climate Readiness Institute and from UC Berkeley and our partners who put on the original workshop, and we thank you, and we thank ARCCA and Julia for putting this webinar together today. So any final comments before we go?
There is one more from Nikki, and then I have a few other things that I'll note. Nikki says smoke also has an interesting effect on areas not being affected by smoke, where folks seek clean air in places like Tahoe or wherever the smoke is not blowing. There is both a caution and an opportunity here. How can outreach and communication strategies direct folks to these areas? How can rural and recreation communities have a strategy for dealing with influxes of people potentially in off seasons when tourism operations have been closed? That's a great comment.
Yeah, good. A part of the big picture of climate refugees that we're going to see more and more of in the coming years from a variety of impacts, and not just within sections of California, but people moving temporarily and permanently in different parts of this country or from country to country. So good catch there. Thank you.
All right, so it doesn't look like we have any other comments coming in. So just wanted to thank you, Bruce, for reaching out to me and getting this set up. I think clearly a lot of great input that we've gotten in the past hour and a half, and hopefully you'll get some more. And definitely thank you to all of our participants for joining us and sharing your thoughts. And as a reminder, we recorded this webinar, so we'll have the video recording along with the 4 draft recommendation documents from the workshops and the participant list. We'll share that with you either later today or early tomorrow morning. We'll also be posting all of this on the ARCCA website. You can see the web address there. If you have any additional questions or input to share, feel free to reach out to Bruce or to me. And we do hope that you can join us for our next learning sessions. We have one on July 18th next week on wildfire resilience in California, the state of the space. We'll have Nuantara Key from the Governor's Office of Planning and Research, as well as Jennifer Montgomery, who is the director of the Governor's Forest Management Task Force. And then the following week, July 23rd, we'll have another webinar focused on scanning the adaptation field, past, present, and emerging needs. So yeah, hopefully we'll see you all again then. To receive updates from ARCCA, we definitely encourage you to visit our website and subscribe to receive updates. And if there aren't any other final thoughts, you can go ahead and wrap up a few minutes early. Thanks so much, everyone, for joining us today. And thank you, Bruce.
Thank you, Julie, and thank you, everyone. Have a good Wednesday.